Hello, everyone. Thank you for joining us today. If you've been following our series on IVF, then you know we've discussed a whole lot of things, including when you need to go see a fertility specialist, what are the most common myths and frequently asked questions about IVF. And today we're going to take you through the basics of IVF. And joining us in this journey today is Dr. Divya Sivaraman. She is the medical director of Shushti Fertility Center in Chennai. Thank you, Dr. Divya, for joining us today.
My pleasure. Thank you.
So, in the conversations that we've been having, with different fertility experts, we've understood that there are a whole lot of other fertility methods as well. That IVF isn't the only one when it comes to treating infertility. Yet, I want to understand that what edge does IVF have as compared to these other methods?
I thank for the opportunity you have kind of given to me to address to such a big, I'm kind of, it's very nice to kind of reach out to so many people. And IVF is, whatever said and done, is an emotionally taxing thing. But having said that, there are ever so many things that we could kind of, which makes IVF stand out of other ART techniques. It's because for starters, IVF could be seen as a test, because all along when people go through various ART or artificial reproductive techniques, they just know, for example, they're going through intrauterine insemination. We know that there is a follicle which is grown, and we know based on the ultrasound findings that it might have got released. But when we do the insemination of the semen or the processed semen sample, we do not know whether the egg actually met the sperm, or whether it got fertilized, or whether it got fertilized and became the embryo stage, whether it reached the womb. We would never know any of those. So when we do an IVF, we are able to see exactly, at least to the fair bit of confidence, as to how the egg quality is, or how the fertilizing capacity of the sperms are, and whether they harm embryos, and whether they're standing the test of time and becoming to the blast stage. So when it gets to a blast stage, basically the pre-baby stage. So if that happens, that basically means that they have good chance of having a baby.
Dr. Divya, sorry to interrupt you, but you're not audible. Can you be a little louder, please?
Sure. Hear me now? Now?
Much better, yes. Thank you.
Oh, perfect. So yeah, so we will know that if it reaches the blastocyst stage, it means they have a really good chance of getting pregnant, whether in this cycle or eventually. So that is one way of telling this. And if you see, people in those days when people had blocked tubes, their pregnancy is basically signed off. But then because of this wonderful technique, we are able to bypass the tubes, and then we are getting the embryo straight into the womb where it should be. So that's why it's great. And again, there are people that we notice that younger women these days are having an accelerated ovarian aging, and it's not very
Sorry, ma'am,
uncommon.
your voice is still not clear. It keeps coming and going.
Oh dear, voice keep on coming and go. Is it okay now?
Can I request you to be a little louder?
Yeah, okay. It's like I'm actually shouting already. Okay, so so the more often we are seeing women with low ovarian reserve, really younger ones, and so there have been multiple studies which have shown that Indian women's ovarian aging is slightly accelerated compared to the rest of the world. So and also we have men too coming with lower sperm counts these days. So those days, the simple ART techniques might not kind of work out for people with reduced ovarian reserve or with reduced sperm count. But IVF has come as a boon for those kind of people. And again, people who are same-sex couples or single women, getting pregnant would be otherwise kind of impossible. So in many situations. So IVF has come out as a big boon. So that way, it stands out from the other things.
Okay.
Yeah, so
All right. So I also wanted to understand that couples who have IVF on their minds, who might be considering IVF, what are some of the things that they should remember as they go in, and talk to an IVF specialist?
Okay, great. It's a fantastic question, I should say. So, before they actually get on to IVF, they should know what they are signing up for. Yeah. That's why, like back in the UK, when we used to practice fertility, when a couple they are approaching an IVF specialist or they are approaching our clinic for an IVF procedure, we advise them to have lesser amount of stress as much as possible because as such IVF is emotionally and financially taxing as well. So that doesn't mean that stress is going to bring down their success in any way. But that said, they have to know what they're signing up for. So the procedure, what it involves, and not having unrealistic expectations. Because so many of the people think, going through IVF, it's like signed off that they're going to have a baby. Sure. But it's more of it's to find out answers to many questions, like why it hasn't happened until now, as because it's such a physiological thing, the pregnancy when it happens. But why is it taking so much time for us? And then they have to understand the cost behind that, because many times when we say, okay, this is the package for an IVF, there are so much of hidden costs attached to it, so that they should know. And that doesn't mean that an IVF conception is going to be way more expensive once after they get pregnant when compared to a normal conception. But sometimes they might need extra drugs to kind of get those number of oocytes and stuff like that. And then they should also understand the implications of an IVF because they are going to stimulate a woman to not to produce just one or two eggs. We have to produce supernumerary eggs. So that means they're going to go through injections on a daily basis, which is going to make their hormones a little haywire. And these are basically menopausal hormones that we're giving them. So they're going to have mood swings and like other side effects like a bloatedness, stuff like that.
Yeah.
And they have to understand risks attached to it. Most of the clinics these days they've made it OHSS free, which is a dreaded kind of complication, which is completely doctor induced, if you like. So it's called ovarian hyperstimulation syndrome, where women who are more prone to develop more number of oocytes or eggs, they claim to develop this condition. So that condition will kind of make them feel all sick and bloated, and sometimes, at its severe case, can cause even endanger the life of the lady. So we are taking a woman who's completely normal to go out of her, comfort zone medically, and which can potentially cause life-threatening complications. So these are the things. Because but why am I saying that? Is there are many people who think like IVF is easy, rather than going through, a simpler technique. They say just do an IVF and get on with it. I can get on with it. It's not without risk. So that they have to know. The procedure costs. And the other thing is, many times you would have enough number of embryos to go back to freeze as well. So they can come back for a kind of another sibling, for the older
Yeah.
child. So that is an advantage of an IVF. So these are the things they can be aware of about IVF, and it's basically they just have to know that there are risks attached to it, advantages attached to it, the potential costs that they're going to have along with that. These are things that they have to know as such before they embark
Okay.
on IVF.
All right. I'm very glad that we're discussing about this because I'm sure a lot of people
Absolutely.
don't,
Yeah. Yes.
think about these things, or it's not in their awareness.
That's true.
Also, is there just one type of IVF, or are there different kinds of IVF procedures that couples can opt for?
Again, the first ever IVF that became successful was the natural side IVF, where they had taken out the egg which naturally came out of that particular lady's uh, ovary, and then they did it. And so that the chance of a natural conception is around 5 to 10%. While when we're doing with one egg, it's maybe close to around 15 to 18%, which is as good as an IUI, intrauterine insemination. But if we want to increase the success of IVF, which is in the best of times, probably about 55 or 60%, we have to get supernumerary eggs. But having said that, we don't want to get too many eggs, which will kind of reduce the quality of the eggs. We want to get around 10 to
15 kind of mature eggs, which will give a good number of embryos, top quality embryos. So with the success for about 45%. So that's what we are kind of aiming for. And when we do that, but that is called as a stimulation, like a conventional stimulation. There are some people who have a very increased ovarian reserve. For those kind of women or people who had previous IVF for complications like ovarian hyperstimulation syndrome, we choose to do what is called as minimal stimulation IVF. Like how we do very minimal number of drugs, and then whatever 4 or 5 follicles that she gets, we would kind of take them out and make them. And we have done like multiple studies, and our center is one of the few centers which does minimal stimulation IVF, where we have seen in multiple studies and audits, which has come out that the pregnancy rate is almost equivalent or comparable to a conventional IVF. So a conventional IVF, we would kind of start stimulation from day 2 onwards, and you're looking at least 10 days of stimulation. But with the minimal stimulation, we are looking at maybe 6 to 7 days of stimulation. So that is minimal stimulation IVF. And natural cycle IVF. Natural cycle IVF mostly we don't do these days because we want a little bit better success. And there's something called a double stimulation, where in women with reduced ovarian reserve, we would we would try and get, or when women are going for cancer chemotherapy, and their time is really kind of very important. So they'll have to try and collect all the eggs as much as possible before they go into chemotherapy, because they can cause potential damage to the gonads. So before they go through chemotherapy or radiotherapy. So we would do what is called as a random start stimulation protocol, where in whichever cycle, part of the cycle the woman is, we would just start stimulation straight away. Or sometimes we would in the first part of the cycle, we start the stimulation, we retrieve the eggs, and then give a couple of days of, the drug-free period, and then we start another stimulation, so that we try and collect as many eggs as much as possible. And sometimes we do what is called as a segmented IVF, where we collect the eggs in multiple cycles and freeze them and transfer them in a completely different cycle. These are the various types of.
So, from what I've understood, the IVF process has multiple stages,
Correct.
right? Can you take us through these stages?
Okay. Typically, optimization is extremely important. And I forgot to mention that in the previous questions, where what are the things that we have to consider
Yeah,
before
yeah.
going to IVF. See, many a times doing the basic tests like thyroid test, or looking for diabetes, or looking at their ovarian reserve, that holds good for the male partner as well. So these are the things we'll have to kind of take into account, because sometimes correction of thyroid issues, correction of obesity is going to kind of go in a big way. Because obesity, when the woman kind of is in the obesity range, and if she reduces about 10 kilos before the IVF, she's going to obviously require less amount of injection, therefore less amount of side effects, and better quality of life.
Yeah.
At the same time, if somebody has an abnormally high or underactive thyroid, if we start giving them the thyroid replacement, you'll be surprised that many times, like, we have scheduled them for an IVF 2 months later, and in that waiting period, many of them have got pregnant. So it's just by correction of the hormone profile, or giving them just nutraceuticals like folic acid and coenzyme Q. And there are many kind of antioxidants we give that during the preparatory phase. And again, when women with low ovarian reserve, we give them on certain drugs to increase the quality of the eggs which are left there, so that when we do the kind of IVF, we get a much better quality of the eggs. So that optimization is extremely important. That will happen in the prior 2 or 3 months prior to actually to put them through IVF. Yeah. And then on a typical IVF cycle, on a day 2, the woman arrives, or in the previous cycle, we would have given them birth control pills or whatever, to what is called as a down regulate, where we get the hormones under our control. And from day 2 onwards, we start stimulation. So they have a baseline scan. We check how many follicles she's forming, and then we do some basic hormone tests. So when I say that, I'm kind of saying all the every IVF thing has to be kind of checked out.
Mm,
Yeah.
mm,
But the one other thing that we are really taking into consideration these days is the COVID vaccination. So I am kind of sitting here with a very, very heavy heart, having lost one of our moms who who got pregnant with IVF. Where the child is motherless
mm.
today because she got COVID, like got to at 33 weeks gestation, and then we had to do. And before we knew, she had already worsened, and unfortunately lost her. Yeah,
Mm.
and I'm not the only one. There are many people who are going through the same thing.
Yeah.
So COVID vaccination now is a new normal. So anybody who's kind of is planning for an IVF, it's a good
Mm.
idea, or even planning a pregnancy, it's a very good idea to have themselves vaccinated. Any vaccine is absolutely fine, so that when they embark into the pregnancy, they are at least they are we are rest assured, even if COVID
Mm.
happens, it's going to be not that severe.
Mm.
Yeah. So coming back on a day two, we plan the protocol for them, and they will kind of just start taking the injections on
Mm.
day three. So women can start injecting themselves, or they come to the clinic to get injections, and then it will always be slightly kind of higher dose because we're going through IVF and we don't want to kind of mess up the success rate.
Mm.
So we would kind of give can higher than normal. Yeah.
Mm.
And then they keep coming periodically to check on the scans to see how well the follicles are growing. Otherwise, we would kind of add in more injections or reduce injections. And then we will also add in another drug to prevent these follicles from getting prematurely released, so that they are there when we go kind of aspirate them. And then final thing would be the maturation injection that we
Mm.
usually give. And 36 hours after that, we will kind of put the woman to sleep and retrieve the eggs. That's called two-cycle treatment. So once that
Mm.
happens, prior to this, during the follicular monitoring period, we would get a backup sample of the male partner because many times
Okay.
when asked to collect on demand, they may not be able to do that. So we have a backup sample. And on that day, we get another fresh sample, just as an example. And then it depends if the man has completely normal count, we would do what is called as a in vitro fertilization, where we just suspend the eggs with sperm, and they would do the fertilization there in vitro. Otherwise, if the count is lesser, or when we have lesser number of eggs, or when they've had previous IVF failures, we would do
Mm.
intracytoplasmic sperm injection, which is ICSI. So once after that is done, they put them back in the incubator, and then after that they would do the fertilization check, and on day three they will see how many embryos they've got, and so ideally we would want to do the embryo transfer on a day five, because that's when the embryo reaches the blastocyst stage, which is more physiological and which has a better implantation potential and therefore better pregnancy rate. So once that is done, after that is the 2 week wait period, and then we would give hormonal support. And when we have supernumerary embryos,
Mm.
we would those will go back to the freezer for use for later. And it's a pregnancy test. If she's pregnant, great, we'll continue with the antenatal care. And if she's not, we'll bring them back for a discussion and to plan further.
Okay. So from the time that somebody comes to your clinic to the time of conception, which let's assume happened in the first cycle itself, how long would you say is a typical IVF cycle? What would be the duration?
Great. You could say it's over a period of 18 days, back and forth. And once after the transfer is done, they pretty much get back home, and it's the waiting period after that.
Hmm.
You
Okay.
could say 3 weeks.
3 weeks, okay. And has COVID, of course, you spoke about the vaccination, and why it's
Mhm.
important now for men and women who are trying to start a family with IVF or without it to be vaccinated. Has COVID
Yes.
changed, the way people are approaching IVF, or the concerns that couples have who are coming in for IVF?
I got to be honest, we have mixed groups. So there's
Mm.
one particular group who thought, like, we've had many of them who dropped out of IVF completely. They've said, like, what is this? We're dealing with a completely different problem, and having a
Yeah.
baby is the least of a priority right now. So we've had some IVF dropouts. And that said, we've had some people who are like really in a hurry to get pregnant ASAP, and they're like, we just want to get the IVF done then and there. We don't want to wait
Mm.
for it. Some people are being even more sensible and say, like, okay, let's have the vaccination. That's all planned now. People who are about to have their IVF, when COVID became worse, they had stopped at that point. They had had their vaccination, and they are planning for like whenever that second dose is done, they become a plan. So it's that way. It's like we have people from all sorts of groups actually.
Okay. So, in your practice, I'm sure you've come across a whole lot of couples who, ask really, I won't say stupid, but really misguided questions about the whole process of IVF. There's so many myths, right, out there. Internet also fuels them.
Yes,
Can you share
yes.
some of the most common myths around this process that you encounter?
Okay. When you say that, no question is, we can never I don't know because when I go and ask in a computer shop or anything, the questions I ask would be completely different. They would even think if this person is even learned. So it's like that. So for them, it's a new thing, So and everything will be in the dark, and unless we have a really guided, because at least IVF, or when people go through fertility, they have to have really good guidance at every point because they are completely in the dark, and then at every point they need the hand holding. But many times the stuff that when we have a negative result and then we bring in the couple to kind of have a chat with them, they want to hear what they want to hear. I notice that quite often because when they go through IVF, like I said before, they think it's 100%. Like
Yeah.
they're like, we did IVF. That's the ultimate. How cannot you get a pregnancy? That's like that. In fact, they're angry with themselves, with us, and stuff like that. So the success rate being 100% or even 110% is one of the myths. Yeah. And then when people go through IVF, they think it's definitely a multiple pregnancy. When we yes, multiple pregnancy can happen even if we try and transfer one single embryo in transfer because it can divide. That is a rarity. But then it depends only upon the number of embryos that we transfer back in the womb. Because we might have like even 10 embryos. Only whatever we decide, the number we decide to put back into the uterus is the number we are going to have, more or less, as a baby. So it doesn't mean multiple pregnancy when IVF is done. And many times when they get pregnant with IVF, they think, oh God, it's going to be, it's a hell of a lot of roller coaster after this. And yes, we do have some blips here and there. They might be coming back with some implantation bleeding and stuff like that. But that doesn't mean they're going to have a C-section at 34 weeks and pull out the baby. It's not that they're going to end up with an ICU or a special care baby unit and stuff like that. So they can have an absolutely kind of full-term pregnancy. Sometimes we've given like vaginal deliveries for many women who conceive with IVF. And the other thing they think is when they get pregnant, the baby is going to be faulty and it's going to be having lots of anomalies or birth problems or birth defects. That again is not a thing. Yes, they might be having a little bit increased chance of going through miscarriage because we're not naturally selecting these embryos. These we are selecting it in vitro. So, and
Yeah.
in which case sometimes those embryos which look microscopically normal might not necessarily have the normal chromosome material. So they might end up having a miscarriage slightly increased than the normal population. But that doesn't mean the ones which are having an ongoing pregnancy are going to have lots of birth defects and stuff like that. And that's usually the thing you'd say. Those are the myths,
Okay.
mostly. Or unless you come up with something, maybe I can adjust to that.
Okay. Sure. Um, in your career, I'm sure you've seen a lot of difficult cases. Can you share the most challenging, case that you've come across, with us today?
Ooh, where can I start? There have been women with, very low ovarian reserve coming back and forth, and sometimes rectal implantation failure is when women have multiple implantation failures is one of the areas of interest. And when we've had like at least 10 or 15 of them, and so whatever we do, it's going to not work out. So sometimes we try, giving them all sorts of what can I say, adjuvants and stuff like that. So we prepare them like that, we've had about 4 or 5 women where we prepared them in
Mm.
the previous cycle and then try to kind of stimulate very, very stringent. And then women, I'm talking about a few ladies who had like very low ovarian pressure,
Yeah.
where we had tested them and then tested those embryos for chromosomal problems, and then kind of checked their endometrium as well to see when the window of implantation is. That test is called ERA. It's endometrium receptivity array, where we see women with recurrent implantation failure. They have a personalized window of implantation. So we find out which is their window of implantation. We transfer those embryos then. And we also have done pre-implantation genetic study on these embryos that they have, and we've chosen one good quality because these women might have even 9 or 10 embryos, but then they may not be chromosomally normal. So where we have done this study on pre-implantation genetic study, we've chosen the euploid, if you like, the one with the normal chromosomes of failure, and we've transferred them into the personalized window of implantation, and we've got women pregnant. So that has been like challenging stuff. And then after we've transferred, we do lots of what is called as immunotherapy, where we don't we make sure that the woman doesn't reject the embryos, and we have like many kind of successful pregnancies like that. And the other thing is adenomyosis is something, it's the condition of the uterus where the inner lining of the uterus is present within the muscle of the uterus, and it can cause a lot of reduced IVF outcome or implantation failure, multiple implantation failure. So those women, that is real challenge. So sometimes we do what is called as a sequential embryo transfer for those kind of women, where we transfer on day 3 of preparation, and then again on day 5 we transfer another set of embryos. So when we've done that kind of thing, so there are certain things, individualization is extremely important in fertility review, because for that particular couple, whatever is right, we'll have to kind of really tailor make the protocols for them and do it. And with those kind of things, it kind of work well. So I could just go on and on because these are the scenarios we come across most often. Those are the
Okay.
difficult ones.
Okay. Um, Before we, bring this session to a close, I want to ask you, what would be your advice or what would you have to say to couples who are still scared of going through IVF?
We can always say that we're going to find out answers to many, many unanswered questions here.
Okay.
So look at it as a test, and it might take more than 1 or 2 attempts to get them pregnant. So when we approach, it's very important to keep their cool. All they have to keep telling themselves is, it's a test. Getting pregnant is a byproduct, and not getting stressed, because they have to maintain the integrity throughout, and we should call off the blame culture in this. We might be doing IVF for a completely a male factor problem, or sometimes only a female factor. So there's no point in the male blaming the woman. You're the reason we're going through IVF, so I have to spend so much, or you're the reason I'm going through so many injections. So that blame culture should not be there. And it actually, an IVF will bring a couple together. It will make their integrity more, or it can really split them apart. So you can have both kind of outcomes to it. So, but the bottom line is they have to stay together in this journey, so that, because that doesn't end there, though they have to see the pregnancy, and there's so many things with that. And always try to involve only the immediate family and not the extended family, because they're going to be all stressed about what we're going to tell them if there's a negative test.
Yeah.
Because see, on daily basis, we'll have to deal with failures as well as IVF consultants, basically. So if 10 people go to IVF, at least for 4 of them, we have to have the discussion of a failure on a daily basis. We do come across this. So as much as one person can get success, and every other person can have a failure. So if we just want to try and find out what's gone wrong here, and if we try and reach up to a good top quality embryo, we cross half a tunnel, you can say, And after that, we will be able to take care of them in a much better way in case it doesn't work out, and we'll be able to tailor make it to their requirements as well. So it's very important to keep the cool and not have a blame culture and have a good support system and keep our, body with a lot of mindfulness and to be in the best of health as much as possible. That would be my
Okay.
advice.
Thank you so much for your time today. This has been truly eye opening. You've taken us through the different phases of IVF, the different type of IVF, and I'm hoping that the audiences, the couples who've tuned in today, who've listened to you, they take away some solid insights from today and are successful in their endeavors. Thank you so much.
Thank you so much. You've been a fantastic host. And I thank Om for the opportunity as well. And I hope we meet again. Yeah. And I wish
Same here.
all of them out there with the best of luck and please have your vaccination. So that if
Yeah,
there's one point you could take home from today, please have the vaccination before you embark on the pregnancy.
yeah. That is
Thank you
the
and God bless.
utmost importance right now.
Yes, absolutely.
Thank you so much.